Right, today we're going to do our first video of the dentist answers. So, you'll have to forgive me, it's been a long time since I did my first video, which is introduction, and I thought I'd better get on with it. Work and family commitments got in the way, so we're going to do it today. So, oral hygiene is about keeping your mouth healthy and clean. Basically, like hand hygiene, keep your hands clean. Oral hygiene is about keeping your mouth healthy and clean. So, yeah, I think we'll just go through what I'd suggest for different situations. And I do a bit of demonstration. So I've got my box here just for use for showing people. I'll hide just a simple cheapy box. We've got this model here. Yeah, the model mouth, plastic teeth in it. Some kids sometimes ask are they real teeth, but they're not. So you can pull them out like so. Display embedded in. So something I can do demonstrations how to, what bridges are. So if a tooth's missing there, what you do for the gap. So I can demonstrate something as a patient if I get time. But this is made for teaching people oral hygiene. So first we need toothbrush. You've got other things in there. We've got floss, this good stuff, Oral-B. Then we've got super floss, which is by Oral-B again, gets underneath bridges and under orthodontic wires. And then we've got different size of interdental brushes, TPs. You can get anyone, you can Asda brand or Boots brand or whatever. You just have to measure up for size because you have to get the right size with these. So with different colours, and I've got some in here. Let me show you. Different sizes, different colour coded TPs. The only problem with these is they do bend smaller sizes, so these skinny little ones, the yellow ones that fit most gaps, people will fit. And let me blue. Aha. Blue and yellow for most gaps. But we've got big gaps at the back. You'd go for like things like the green and the purple. And if you've got really skinny gaps, you can go for the red. Normally in the front bottom teeth, there, TP, little brushes, and the smaller one. And the pink. Yeah, the pink, then you got pink, and then small, really tiny orange. But then when you get really small, you're probably looking at flossing, getting in those areas. So, then you've got these ones, the floss handles, flossettes or floss picks, which are easy to use, so they kind of go in between. They do tend, and the cheaper ones tend to flex in tighter gaps. So I have to yank them out. And you've got a little bit for going in between. But that's more for fishing food out. That won't really clean the surfaces. That's for fishing food out. We don't use needles or metal things, just like that. So we'll go with brushing first. So the way I show people brushing, now different dentists show different ways. So just in my way, okay? Brushing, toothbrush. Change it. It's usually quite good Curaprox brushes, but Oral-B indicator brushes are good as well. The Oral-B indicators. You get a pack of 3 for $2.99 from Lidl. Oral-B indicator, and they're quite good. So you got Curaprox. The head's quite small. That's what you want for toothbrush. Bit of an angle in it, angled. See, bit of an angle. So it's easy to get the back teeth. Small head, you don't want a big head. It gets to the back ones easier. The head is the size of this bit of bristles. So that's, these are quite good. Normally I think you can only get these in dental practices, so we sell these at our place. Can't remember how much, but the Oral-B indicators are really good. The Oral-B indicators are similar, even a smaller head than that, and they're really good. So if you get it for $2.99, that's about £1 each. $2.99 I think Lidl. B&M bargains, not Lidl. So that's really good. So what you want to do is always make sure you get up to gum margin. Don't scrub too hard. So I show people, first of all, you want to go side to side, firm pressure. Like so. And then you go to the biting surfaces. Then onto the inside. Now when you do the inside, do the inside as much as the outside, side to side. When you do the front ones, it's a bit hard to see on the inside. So stroke downwards. It's hard to go side to side, it can be a bit tight, stroke downwards. With the bottom teeth, you want to stroke up. So upwards like that. Okay. Then, for the top teeth, at an angle, we'll show you this way round, an angle, did it bristle at an angle and stroke down, and just go around like that, stroking down. And you're going to obviously swap around that way with the bottom teeth, an angle again, stroke up, and then inside and outside, and then kind of like a rotation, so like that. A lot of people do say side to side can cause tooth wear, because if you're really scrubbing excessively, you can cause the gum to get damaged. When the gum gets damaged, it shrinks or recedes, and you can cause tooth wear and sometimes notching. Now, if the notching gets really bad, or the rubbing away the tooth gets really bad, they can get really sensitive. In extreme cases, the nerve can die. That happened to one of my patients because he wouldn't stop brushing excessively hard. When you do get sensitivity, either through brushing too hard, when the gum shrinks, you want to start to use Sensodyne. And then use Sensodyne every morning or night. So if you use Sensodyne every morning or night, or any kind of sensitive toothpaste, I would say also any sensitive areas, just massage it with your finger into the tooth and leave it on. And that will help with sensitivity. So, the other thing is very important, scrub the biting parts of your teeth really hard. You don't want to cause any damage. Remember what I said about scrubbing excessively hard on the sides? You cause tooth wear and gum damage and the gum shrink. You can brush the biting parts of your back teeth really hard. These are called the grooves in the biting surface, or fissures. The grooves in the biting surfaces are fissures. These can decay easily, and a lot of time they can be a bit stained or darkened, which could be decay that got on harder, or just staining. So you're not going to cause any damage if you scrub really hard. So really scrub these surfaces really hard, because back teeth wear more food and bacteria collect and accumulate, so you need to just scrub those surfaces really hard. So you want to be looking to brush for 2 to 3 minutes. Do time 2 to 3 minutes. You're never going to do 2 to 3 minutes more than likely if you time to work it out. So you can get these little egg timers. You can buy them for anywhere. I'm sure you get them off Amazon as well. Turn them over 2-minute timer, or just use clock or stopwatch or something like that. So that's brushing. 2 minutes morning, 2 minutes at night. If you do a third brush in a day, that's excellent. But change your toothbrush every 2 months. If the bristles go like that, get splayed, and that's after a month, change it. It's not doing its job anymore. So that new feeling when you've got a new toothbrush, that's the kind of feeling you want to continue to have. If you don't get that feeling, even if you change it every month, for example, like I said, there's Oral-B indicator toothbrushes. Look up Google Oral-B indicator, and even in Boots, I think they're $1.25 each. £1 a month. Change it every month. You're just going to make sure you keep your teeth healthy and clean. But these brushes are good. So that's one thing we're going to show you. The brushing, flossing, cleaning in between, really important. So the brushing, that's a bulk clean. Now you want to look at flossing. Flossing is quite technique. We call it technique sensitive, meaning it's based on technique. So floss, Oral-B satin floss, really good. You've seen ads everywhere. Look for the blue box. What you do, break off a reasonable amount, like so. It seems quite a lot, but I'll show you why. You break it off. Wrap it on one finger. Then, come on, we'll do this. Wrap it a bit around one finger, then reel it around the other finger. Support your thumb, or your fingers, or a bit of both, whatever's comfortable. You reel it around the other finger, because every few teeth you're going to move it along. So use a fresh bit. Here's the thing you need to do. A bit hard to show. Let me just tilt this down a little bit more. Okay, what you want to do is you want to get the floss as far as you can go under the gum and then scrape. Yeah? So under the gum, scrape. Let me show you top one, top front one. So what you want to do is, you're not just going in between, you want to get tooth surface under the gum, both sides of that V shape, the pointy bit of gum, the pointy. So here, see how far that's going? And scrape. It's a bit hard to show like this. And then the other side, the other way. Oh, that's difficult. And then scrape. That's what you want to do. What I find when you go to the back teeth, it's a bit harder to see. So what you want to do is, if you go to pull it forward, it automatically go to the front bit. Push it back to go to the back. Pull it forward and push it back, and you'll feel it click underneath the surface. and move it on every few teeth. Try and do that morning and night. The best is morning and night. If you do once a day at night, that's good as well. So you're brushing and flossing. Once you brush and floss, rinse your mouth out. Then get your toothbrush, brush with more toothpaste around your teeth. Then don't rinse out, just spit out, leave it on. So that's just for basic stuff. If you go next stage, which is really good, you use these TP's interdental brushes. Okay, and they're step for size. So what you want to do is an angle right into the gum. See it go through? And do a couple of strokes, 2 or 3 good strokes, just gently, finger pressure, don't force it. Now that's about right, yeah? So you don't want to be jiggling around, you want to feel the bristles rubbing, not the metal core. You can see that, yeah? So, right in between. A lot of people, what they do, they buy them and they just use tiny ones and they jiggle around. But commonly, believe it or not, that's the size you need. Either purple or green. The purple being the big one. A lot of time it's purple. The problem about the blue, and any of the thinner ones, so the blue ones, I'm not going out of the packet one, can't be bothered to just show you this. These ones, they bend easily because the metal wire is thinner, but in the bigger ones, they're thicker. The metal wire that holds the bristles. So again, just go right into the gum. Now what you want to do is lots of different sizes, yeah? So you're talking about green, and that's like, see, it's gripping. A couple of strokes. And once you've used them, rinse them out and flick them. Now one thing they have in the pack, you'll get one of these. So the one you're using, keep out the packet. And when you're using it, use it as a handle. And when you've used it, give it a wash, give it a flick, make sure it's not gritty or groggy, and figure out, maybe after a week or so, a couple of days, a week or so, just change. Don't throw these away. Floss, throw it away, straight away. Internet brushes, use it for maybe a week. If it's grimy and groggy, get rid. That's the key. TP brushes are quite expensive. They are really good quality, but they're quite expensive. You can get Asda, Boots, or Superdrug equivalent, versions of them. They won't be completely identical. So this, a red one from Boots or Asda's brand or Superdrug's brand, will not be the same because they can't make identical. So what you want to do is look for size, and the sizing is here. Where is the sizing? 8 brushes. So they got like size code, and they used to be millimeters how much size they were. All I would do is go to the TPs, because normally dentists, when they demonstrate this to you, they'll if they do a demonstration for you for any reason, commonly we do it with people who've got really gums that aren't great, or for going under bridges. So that's what I'm going to get to in a minute. You want to just see the same size and try and match it for the same size of the Boots or the Superdrug one. If you want to get these, that's fine. You can probably get them cheap online than get them from the store anyway. Okay, so if you've got a bridge, so a bridge is where it bridges a gap. So someone, like I demonstrated before, someone's lost that tooth there. So someone would have drilled, a dentist would have drilled this one here down and this one there, take a mould, send it to lab. You get a cap or cover, sits on that one, cap or cover sits on that one, and a tooth stuck in the middle. So you have a bridge. So this is connected to that one directly across. So you can't go in between it like this with floss. You can't go in between because it will stick. It will not go. So what you need to use is one of two things. I'll get into the other thing. Interdental brushes to get underneath. Come on. Get underneath. Yeah. If you want to really go for a bridge, and I would honestly, if you've got bridges, keep them really clean. So what you want to do is use that interdental brushes or super floss. So super floss is for going under bridges and stuff like that, and I've got a strand of it here that I do for demonstration model. So what you've got with super floss is a rigid, flexible, kind of fairly flexible but rigid plasticky end. You're not going to use that for cleaning, that's for guiding it underneath the bridge. fluffy bit and a flossing bit, this bit here, although I've got to say it's a bit more thicker than the satin floss. Okay, so here what you do when you're doing underneath, you have to hold it right near the tip, because if you don't, it'll just bend. If you hold it there, it'll just bend when trying to pass it underneath. It'll still bend a bit anyway. So what you're going to do is, again, push it, trying to get it close, underneath. I can't do it because it's not a bridge, it's going to just come through anyway, but I'm demonstrating. Go underneath there, all the way through. This is a faff, but it's worth it. Underneath, pull it all the way through, and then you go to normal floss. Under the gum, yeah? Under the gum, it'll actually, with a bridge, it'll go right across, because there's no tooth there, yeah? Right across, then it'll come to this end. It'll be go underneath, because I haven't got a bridge to show you. Under there. Turn it down a bit more. And then you'll go under the gum there, under the gum there, and then you'll have to pull it back through. Now if you've got one bridge, that's not too bad, but you've got numerous bridges, that's going to be a pain. It's going to be a pain to do, but it's worth it. It's really worth it. So you can use, what you'd use for a bridge is normal brushing, interdental brushes on their own if you want, or if you really want to go for it, interdental brushes, then super floss. And the super floss is normally available at places, Boots and Superdrug, probably not in normal places, Asda or Tesco's. Maybe, you never know, but that's good stuff. Because what it is not a veal, you just pull it off as a strand. So in the packet there, it's a strand, you pull it off. And there's a certain number of strands, so you just pull it off like that. Yeah? Got it? Right, so that's that. If you really want to, if you've got bridges. Do you have a thing made for implants? The implants is when you've lost a tooth. Pull this out again. And then the bone's healed and stuff after taking out. They literally drill in a hole into the bone, titanium post, embed it in, it goes in, the bone fuses to the post, then they put a cap on afterwards. So that'd be a cap. Floss will still clean underneath, but then the brushes would be really good. Now, implants are really expensive, so if you get one, you want to look after it. So definitely interdental brushing, and definitely getting a hygienist to clean it, because they use a special tool to clean the implant surface. That's not like the metal scale you normally have this cleaning with. It's like a plastic tip, so that's what you're doing there and there. Yeah. Go in between and in between. Just keep it really important to keep clean. Don't overload the implants. Don't work them too hard. Okay. Yeah. So flossing. The alternative to normal floss, the normal Oral-B floss, is the floss on a handle. Floss it. Now remember what I told you is that it's quite well on cheaper versions. It's quite thick, so it's not like normal floss. That's nice and thin. It's quite thick. So in tighter gaps can be difficult. You're gonna find, when I find it, whenever I use it, it's kind of like, I feel like you're forcing it down and yanking it out. You're having to force it and yank it, and it's not nice. So sometimes, but they're much easier to use. So what you're going to do is exactly the same principle. Under the gum, as far as you can go under the gum, and scrape, and you must get as far as it will go under the gum. It's sometimes mad how far you go under the gum. So just be aware of that. You're going to have to use more. And because you're paying for the plastic handle, it's going to cost more. Now, the best ones that I've found are the Wisdom ones. Wisdom, so, but they're not cheap. And if you're using this every day and using a couple for the top, couple for the bottom, it could get expensive. But, you know, you're looking after teeth and gums, it's worth it. But better you get used to using floss and practice. If I could do it, anybody could do it. It's not that difficult. Not difficult floss, just persevere. Some patients say to me, oh, I can't do the back teeth. They don't really do the back teeth. I say, just floss the ones you want to keep. Just clean in between the ones you want to keep. Just brush the ones you want to keep. Because if you don't brush them good, they're just going to get gum problems, decay problems, other issues. Gum disease is the biggest issue, because gum disease affects all your teeth. You get decay in the tooth, that's different. Gum disease, right. So one other thing I want to show you. I think I've covered everything. Yeah. But, yeah. So this is called an interspace brush. So it is like a toothbrush with a fraction of the bristles, and they're pointed. So this will get in nooks and crannies. If people have really crowded teeth, you can just get in between. But one of the good things for it, if you've got a wisdom tooth that's partly through and it's stuck behind the tooth behind, commonly they're at an angle and food's getting stuck in, you can just clean it really beautifully around there. If you've got a wisdom tooth that's stuck and getting food packing, and it's partly food, it's better to get it out, because the food packing will eventually lead to gum disease and decay in the one in front. Yeah, and it happened to someone I know, a close family member, where she didn't have the tooth taken out, and she got decay in the back, and because she lives in the Gambia, right? They were saying, "Oh, we'll just fix this tooth, we'll root treat this tooth, leave the wisdom tooth." But I said to her, "You're going to have the same problem again. That's going to cause decay. Even if they could fix it and root treat and fix it, which they probably can't, they're just trying to take advantage of you. They'll get decay underneath and get more decay underneath and get more problems." So she ended up having to have that tooth taken out. The tooth in front of the wisdom just sitting there pretty much doing nothing, useless, because it's still not come through properly and fully. So if you clean there, that's good. The other thing that cleans these areas good are water flossers. We'll do another video on water flossers and electric toothbrushes. So the difference between a manual toothbrush and electric toothbrush are just like night and day. Electric toothbrushes are superb. Oral-B's are excellent, rotating head, get the circular head. And the water floss are really good. Now, water flossers suggest that water flossing is more efficient than normal flossing. It's not. In the hands of someone who could do flossing is far more efficient than water flossing. It's better than water flossing, not far more efficient, better. Because you're physically removing the build-up in the food and the bacteria disrupting everything. With a water floss is just a miniature jet wash. And I say to patients, if you were to go to the car wash and they just jet washed your car, it'll be cleaner, but not clean. And if they jet washed your car and say, "That'll be £5, please," you said, "You haven't cleaned my car." Because all they do, they take the most of the dirt away, but then they have to use a sponge and a brush on your car. The same principle for your teeth. You have to brush, floss, then use a water flosser. Brush, floss, interdental brush, then use the water flosser, then brush some more paste on, leave it on, toothpaste on, leave it on, then you've done everything. Water flossers are really good. They help people who've got gum disease a lot, and they help people who haven't got the ability to use floss or interdental brush, because maybe they've got some issue with dexterity with their hands. Okay, so they've got their place, but I would say if you're going to use it, and you can use it, brush, maybe electric toothbrush, floss, normal floss, interdental brush in between all the gaps, different sizes, remember size specific, so one size does not fit all, and then water floss, and then brush some more paste to leave it on. That sounds excessive, but that is the best. So if you do that, that's excellent. So I think I've done that. Some people find it difficult to clean well, so disclosing tablets can use. Disclosing tablets are little things that dye the build up. Leave a dye. It's like based on beetroot, I think. So it dyes the area. It does dye your whole mouth, so be aware of that. But that's worth considering as well. But the main thing, 2 to 3 minutes brushing, good brushing. They're going to be clean. They're going to be good. Most cases when people aren't cleaning very well is because they're not following the instructions properly. They're not brushed for well enough, and they're not giving enough firm pressure. Remember, don't scrub excessively, but you need firm pressure. Biting says scrub really hard. So that's the first video on oral hygiene. We're also going to go through, I'll get my electric toothbrush out for the next one, and my water floss, and I'll try and do that maybe in the sink to demonstrate. Maybe, we'll see. Anyway, so I hope you liked the video. Please comment, like, subscribe, and if you've got any questions, put them down there. I'll try and answer them. I'll do my best. Now, I'm a dentist, NHS dentist. I'm sometimes not spot on with everything. Maybe some people will agree with me, some people won't. Some dentists, it's what I've learned over the years. It's worked for me and my patients, so if it works for me and my patients, hopefully it'll work for you. So we'll see you next time, okay? Thanks for watching.